All right, welcome. Today, we're going to go on an absolutely incredible journey. We're not traveling across the world, though. We're going deep inside the human body to follow the path of a single dose of medicine.
It almost feels like magic, doesn't it? You've got a headache, you swallow a pill, and an hour later, poof, the pain is gone. But what actually happens in that hour? Well, it's a super fascinating story of biology, chemistry, and perfect timing.
So there's a fancy scientific name for this whole process, pharmacokinetics. But don't let that intimidate you. All it means is the study of what the body does to a drug. See, we're not focused on what the drug does to the body. That's a whole other thing called pharmacodynamics. Nope, today we're following the drug's adventure from the second it gets in to the second it gets out.
And why should you care about this journey? Well, if you're a healthcare professional, especially a nurse, this is everything. Understanding pharmacokinetics is the bedrock of safe medication administration. It's literally the rule book that helps you make sure a drug does its job without causing harm.
So this whole journey has 4 main stages, and luckily there's a super simple acronym to remember them, ADME. That's absorption, distribution, metabolism, and excretion. This is our roadmap for the next few minutes. Let's dive in. First up, Act 1, absorption. This is the drug's very first challenge. It has to get from where you put it, like your stomach, into the body's main transportation system, the bloodstream. Think of absorption as the ultimate gatekeeper. If the drug can't get past this stage, the journey is over before it even has a chance to start.
Now, here's where it gets really interesting because the starting line completely changes the race. If you take an oral pill, it has to go on this long, tough journey through the gut and the liver. But an IV or IV drug, that gets the VIP treatment. It's injected right into the vein, completely bypassing absorption. This is exactly why a nurse knows that IV pain medicine is going to bring relief in just minutes, while a pill might take a whole lot longer.
And that brings us to a super important idea, bioavailability. It's basically the percentage of the drug that actually makes it into your bloodstream ready to work. For those oral drugs, there's a massive hurdle called the first pass effect. Think of it like a toll booth. The liver gets the first chance to break down the drug, which can seriously reduce the amount that actually gets through to do its job. And this chart shows you exactly what that looks like. Because IV drugs go straight into the blood, their bioavailability is a perfect 100%. Every single bit you give gets in. But for an oral drug, thanks to that first pass effect, it's pretty much always going to be less than 100%. Okay, so our drug made it into the bloodstream. Mission accomplished. Now we're at part 2, distribution. The drug is officially riding the circulatory superhighway, and it's time to travel to its destination. Distribution is, well, exactly what it sounds like. It's the process of the drug moving out of the blood and spreading into all the different body tissues and organs to find the spot where it can finally get to work. So how far does it spread? We actually measure that with something called the volume of distribution, or VD. A drug with a small VD is kind of like a homebody. It pretty much stays put inside the bloodstream. But a drug with a large VD, that one's an adventurer. It leaves the blood and travels far and wide, setting up camp in tissues like fat and muscle. So once the drug has been distributed and done its thing, the body starts the cleanup process. And that brings us to part 3, metabolism. This is the great transformation, and it happens mostly in the body's main chemical processing plant, the liver. Metabolism is basically where the body's enzymes get to work and chemically change the drug. The main goal here isn't just to destroy it, but to change it into a form that's more water-soluble. Why? Because that makes it way, way easier for the body to flush it out later on. This chemical makeover sets the stage for the final act of our drug's journey. So let's move on to part 4, excretion. The drug has served its purpose, it's been transformed, and now it's time to show it the door. Excretion is the final step, the removal of the drug and all its byproducts. And the undisputed champion of excretion? The kidneys. This is exactly why nurses keep such a close eye on a patient's kidney function. If the kidneys aren't working right, the drug can't get out, and it might hang around long enough to cause some serious trouble. Now, the speed of this grand exit is measured by a concept that is absolutely critical: a drug's half-life. Simply put, it's the time it takes for the body to get rid of exactly half of the drug that's in your system. Just look at this example. Let's say you start with 100 milligrams. After one half-life goes by, you're down to 50. After a second half-life, you're at 25, then 12.5, and so on. This predictability is an absolute game changer in medicine because it lets us calculate precisely when to give the next dose to keep the drug working without becoming toxic.
See, that half-life is so important because it tells us the dosing schedule. The whole goal is to reach something called a steady state, which is where the amount of drug you're taking in equals the amount your body is getting rid of. This keeps the drug level in the therapeutic window, that sweet spot where it's working but it's not yet toxic. And a good rule of thumb is that it takes about 4 to 5 half-lives to reach that steady state.
Okay, we followed the drug's entire wild journey. Now, let's bring it all back into the real world. In this last section, let's see how a nurse uses all this knowledge to take care of patients safely and effectively. Understanding all this ADME stuff lets us be really smart about dosing. Let's say a drug has a really long half-life. Waiting 5 half-lives for it to start working could take days. So to fix that, a doctor might order a big initial loading dose to get the drug levels up into that therapeutic window fast. Then, the patient gets switched to smaller, regular maintenance doses to keep them in that perfect steady state sweet spot. So when you look at this checklist, you can see it's not just a list of tasks. It's the whole ADME journey from a nurse's point of view. Nurses are really the frontline guardians of pharmacokinetics. They're constantly watching to see how a patient's body is handling this whole 4-part journey. And really, it all comes back to this one idea. Every single stage we just talked about, absorption, distribution, metabolism, and excretion, directly impacts whether that medicine is going to help someone or hurt them. They're two sides of the very same coin. So you see, this isn't just some abstract science. The next time you give a medication, think about its 4-act play. If your patient has kidney disease, is their body going to struggle with excretion? If they have liver problems, what's that going to do to metabolism? So let me ask you, for your next patient, which stage of this journey will you be watching most closely?